Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on Marfan syndrome. So let us start. What is Marfan syndrome? Marfan syndrome is an inherited disorder that affects connective tissue, the fibers that support and anchor your organs and other structures in your body. Marfan syndrome most commonly affects the blood, eyes, heart, vessels, and skeleton. People with Marfan syndrome are usually tall and thin with unusually long arms, legs, fingers, and toes. The damage caused by the Marfan syndrome can be mild or severe if your aorta, the large blood vessels that carries the blood from your heart to the rest of your body, is affected. The condition can become life-threatening. So treatment usually include medications to keep your blood pressure to low to reduce the strain on your aorta, and regular monitoring to check for damage progression is vital. And many people with Marfan syndrome eventually require preventive surgery to repair the aorta. What are the symptoms? The signs and symptoms of Marfan syndrome can vary greatly even among members of the same family because the disorder can affect so many different areas of the body. Some people experience only mild effects, but others develop life-threatening complications. Marfan syndrome features may include tall and slender build, disproportionately long arms, legs, and fingers. Longer arms are seen in Marfan syndrome, a breastbone that protrudes outwards or dips inwards, a high arch palate and crowded teeth, and heart murmurs, extreme nearsightedness, and abnormally curved spine and flat feet are also been observed in Marfan syndrome. When to see your doctor? If you think that you or your child may have Marfan syndrome, talk to your doctor or pediatrician. If your doctor suspects a problem, you will be likely to be referred to a specialist for further evaluation. What are the causes? Marfan syndrome is caused by the defect in the gene that enables your body to produce a protein that helps gives connective tissue its elasticity and its strength. Most people with Marfan syndrome inherit the abnormal gene from a parent who has the disorder. Each child of an affected parent has a 50 to 50% chance of inheriting the defective gene. In about 25% of people who have Marfan syndrome, the abnormal gene comes from neither parents. In these cases, a new mutation develops spontaneously. What are the risk factors? Marfan syndrome affects men and women equally and occurs among all races and ethnic groups. Because it's a genetic condition, the greatest risk factor for Marfan syndrome is having a parent with the disorder. What are the complications of Marfan syndrome? Because Marfan syndrome can affect almost any part of the body, it may cause a wide variety of complications. Suppose cardiovascular complications. The most dangerous complication of Marfan syndrome involves the heart and blood vessels. Faulty connective tissue can weaken the aorta, the large artery that arises from the heart and supplies blood to the body, and its cause aortic aneurysm. The pressure of the blood leaving your heart can cause the wall of your aorta to bulge out like a weak spot in a teeter. And in people who have Marfan syndrome, this is most likely to happen at the aortic root where the artery leaves your heart. There can be lens dislocation, there can be aortic aneurysm and aortic dissection, retinal detachment, scoliosis also. What is aortic dissection? The wall of the aorta is made up of layers. Dissection occurs when a small tear in the innermost layer of the aorta walls allows blood to squeeze between the inner and outer layers of the wall. This can cause severe pain in the chest or back. An aortic dissection weakens the vessel's structure and can result in a rupture which may be fatal. Then valve malformations. People who have Marfan syndrome can have weak tissue in their heart valves. This can produce the stretching of the valve tissue and abnormal valve function. When heart valves do not work properly, your heart often has to work harder to compensate, and this can eventually lead to the heart failure. What are eye complications? Eye complications may include lens dislocation. The focusing lens within the eye can move out of the place if it is supporting structures are weakened. The medical term for this problem is Ectopia lentis, and it occurs in more than half of the people who have Marfan syndrome. Then retinal problems might occur. Marfan syndrome also increases the risk of a detachment or tear in the retina, the light sensitive tissue that lines the back wall of your eye. Then early onset of glaucoma or cataracts occur. People who have Marfan syndrome tend to develop these eye problems at a younger age. Glaucoma causes the pressure within the eye to increase, which can damage the ectopic nerve. Cataracts are cloudy areas in the eye's normally clear lens. Then there are skeletal complications. Marfan syndrome increases the risk of abnormal curves in the spine, such as scoliosis. It can also interfere with the normal development of the ribs, which can cause the breast bone to either protrude or appear sunken into the chest. Foot pain and low back pain are common with Marfan syndrome. Then, what are the complications during pregnancy? Marfan syndrome can weaken the walls of the aorta, the main artery that leaves the heart. During pregnancy, the heart pumps more blood than usual. This can put extra stress on the aorta, which can increase the risk of a deadly dissection or rupture of the aorta. As far as diagnosis is concerned, Marfan syndrome can be challenging for doctors to diagnose because many connective tissue disorders have similar signs and symptoms. Even among members of the same family, the signs and symptoms of Marfan syndrome vary widely both in their features and in their severity. Certain combinations of symptoms in family history may be present to confirm a diagnosis of Marfan syndrome. In some cases, a person may have some features of Marfan syndrome but not enough of them to be diagnosed with the disorder, such as heart tests are done. If your doctor suspects Marfan syndrome, one of the first tests he or she may recommend is an echocardiogram. This test uses sound waves to capture real-time images of your heart in motion. It checks the condition of your heart pulse and the size of your aorta. Other heart imaging options include computerized tomography, CT scans, and a magnetic resonance imaging (MRI). If you are diagnosed with Marfan syndrome, you will need to have regular imaging tests to monitor the size and condition of your aorta. Then eye tests are being recommended. Eye exams that may be needed include slit lamp exam. This test checks for lens dislocation, cataracts, or a detached retina. Your eyes will need to be completely dilated with the drops for this exam. Eye pressure test to check for glaucoma or tonometry is being done by the doctor. He will measure the pressure inside your eyeball by touching it with a special tool, which is tonometry and tonometer. And numbing eye drops are usually used before this test. Then genetic counseling, genetic testing is being done. Genetic testing is often used to confirm the diagnosis of Marfan syndrome. If a Marfan mutation is found, family members can be tested to see if they are also affected. You may want to talk to the genetic counselor before starting a family to see what your chances are of passing on Marfan syndrome to your future children. What is the treatment? While there is no cure for Marfan syndrome, treatment focuses on preventing the various complications of the disease. To accomplish this, you will need to be checked regularly for signs that the damage caused by the disease is progressing. In the past, people who had Marfan syndrome often died young. With regular monitoring and modern treatment, most people with Marfan syndrome can now expect to live a more normal lifespan. What are the medications? Doctors often prescribe blood pressure lowering drugs to help prevent the aorta from enlarging and to reduce the risk of dissection and rupture of the aorta. What is the therapy? The vision problems associated with a dislocated lens in your eye often can be corrected with the glasses or contact lenses. What are the surgical and other procedures being done on Marfan syndrome? Depending on your size and symptoms, procedure might include aortic repair. If your aorta diameter reaches about 2 inches, 50 millimeters, or if it is enlarged rapidly, your doctor may recommend an operation to replace a portion of your aorta with a tube made of synthetic material. This can help prevent a life-threatening rupture. Your aortic valve may need to be replaced as well. And then is a scoliosis treatment. When there is a significant scoliosis, a consultation with a spine expert is necessary. Bracing and surgery are needed in some cases. Then breastbone corrections are being done. Surgical options are available to correct the appearances of sunken or protruding breastbones. Because these options are often considered to be for cosmetic purposes, your insurance might not cover the cost. Then eye surgeries. In part of your retina haven't torn or come loose from back of your eye, or surgical repair is usually successful in retinal detachment. If you have cataracts, your clouded lens can be replaced with an artificial lens. Then lifestyle and home remedies might be helpful. You may need to avoid competitive sports and certain recreational activities if you are at increased risk of aortic dissection or rupture. Increases in blood pressure common in activities such as weightlifting place extra strain on the aorta, and less intense activities such as brisk walking, bowling, doubles, tennis, or golf are generally safer. Coping and support. Living with a genetic disorder can be extremely difficult for both adults and children. Adults may wonder how the disease will affect their careers, their relationships, and their sense of themselves, and they may worry about passing the defective gene to their children. But Marfan syndrome can be even harder on young people, especially because the often inherent self-consciousness of childhood and adolescence may be exacerbated by the disease effect on appearance, academic performance, and motor skills. Helping children cope. Working together, parents, teachers, and medical professionals can provide children with both emotional support and practical solutions for some of the more distressing aspects of the disease. For example, children with Marfan syndrome may struggle in school because of vision problems that may be corrected with the glasses or contact lenses. For most young people, cosmetic concerns are at least as important as academic ones, and parents can help by anticipating these concerns and offering solutions such as contact lens, stand-off glasses, and a brace for scoliosis, dental work for crowded teeth, and clothes that flatter a tall, thin frame. Then support groups might help. People who have Marfan syndrome often find it helpful to talk with others facing the similar challenges, and the Marfan Foundation provides a variety of support services online. Preparing for your appointment. Marfan syndrome can affect many different parts of your body, so you may need to see a variety of medical specialists such as a cardiologist, a doctor who specializes in heart or blood vessels disorders, an ophthalmologist, a doctor who specializes in eye disorders, an orthopedist, a doctor who specializes in structural problems of the skeleton, a geneticist, a doctor who specializes in genetic disorders. To make the best use of appointment time, plan ahead and have important information available, including detailed descriptions of all your symptoms, details of your past medical history, including any previous surgeries, past x-rays, and echocardiogram reports, which often can be sent electronically. A list of all your medications you take and supplements you take should be known to your doctor. What to expect from your doctor. All your doctor will want to hear about your specific symptoms and whether anyone in your family has had Marfan syndrome or experienced an early unexplained heart-related disability or death. So this was all about Marfan syndrome, and I hope so that this video would be very helpful and informative for the audience, and I hope so that if you have liked this video, and then don't forget to subscribe my channel and share this video with other individuals as well. And thank you for listening this video. Have a wonderful nice day.